12 early signs of liver cirrhosis that you need to be aware of. Hi, it's Dr. Derek here. What if I was to tell you that there's a condition that causes 2 million deaths worldwide per year? Would you want to know more about it? Now, studies such as this one here have shown that liver cirrhosis is currently the 11th most common cause of deaths globally. Now, there seems to be a lot of confusion about this condition around the world and also among some of the patients that come to see me in my clinic. So let me simplify it for you. Liver cirrhosis is a condition in which the liver is permanently damaged and all the healthy liver cells are replaced by scar tissue. Now, this scar tissue is unable to perform any of the usual functions that the healthy liver cells previously did. And as a result of this, we see various signs and symptoms. Now, the key here to remember is that this condition is irreversible. This is why you must do everything you can to avoid getting it in the first place. So I'm going to go through 12 early signs of this condition in today's video. And if you stick around towards the end of this video, I'll tell you what you need to do to avoid even reaching this irreversible stage of liver damage. Let's dive straight in. Starting at number 12 is a loss of appetite. Now, this occurs in liver cirrhosis because in this condition, levels of our hunger hormones such as leptin are abnormal. In particular, leptin levels are elevated, which then suppresses the feeling of hunger and also increases the amount of energy the body uses up. This effect on hunger hormones also leads to symptom number 11 on our list. This is weight loss. As we know, eating less and burning more energy will lead to a loss of weight. Now, one of the main functions of the liver is to produce platelets. When healthy cells are replaced by scar tissue, like what we see in liver cirrhosis, the liver can't perform this function. This leads to a condition known as thrombocytopenia. This is the 10th sign to be aware of in our list of 12 early signs of liver cirrhosis. Now, thrombocytopenia essentially means low platelets. Platelets stop bleeding by clumping together and forming plugs when a blood vessel gets injured in any way. Therefore, another early symptom that may be seen in cirrhosis, our 9th on this list of 12 to be aware of, are signs of bleeding, such as easy or excessive bruising. You may even see things such as a prolonged bleeding from cuts. Staying with the same theme of blood work, and next up on our list in number 8 is the presence of deranged liver function blood tests. We see this particularly in our liver enzymes such as aspartate aminotransferase and alanine aminotransferase, which will be significantly elevated in cirrhosis. When the liver is damaged, such as what we see in liver cirrhosis, the liver cell membranes become more permeable, and these enzymes leak out into the bloodstream. This is what causes the levels to raise in a blood test. Next up in number 7 is jaundice. This is the yellowing of the skin or the white of the eye. Now, this yellowing is caused by a colored compound that is known as bilirubin. Jaundice occurs when the liver struggles to process this bilirubin. Which occurs because there are less healthy cells in liver cirrhosis to do this. You therefore have an accumulation of bilirubin in the bloodstream, which causes yellowing of the skin and of the eyes. Number 6 in our list of early signs of liver cirrhosis is a condition known as spider angiomas. These are basically spider-like blood vessels that can appear on the skin. Now, this occurs because the body's ability to metabolize sex hormones such as estrogen is affected in liver cirrhosis. An increase in circulated estrogen levels has been shown to be linked to these spider angiomas. It is also for this reason of increased estrogen levels that we see our next sign of liver cirrhosis. Number 5 on our list. This is excess breast tissue development in men. So, up next in number 4 is the development of esophageal varices. This is a serious complication of liver cirrhosis, and it's basically the presence of enlarged veins in the esophagus. Now, this is the tube that connects the throat to the stomach. Esophageal varices develop because in liver cirrhosis, you have a blockage of the regular blood flow to the liver due to all the scar tissue that has formed. Now, to get around this, the blood flows through smaller blood vessels that aren't really equipped to carry these large volumes of blood. Now, because of this, the blood vessels can burst, causing life-threatening internal bleeding. So, down to our final 3 symptoms you must be aware of, and in number 3 is a condition known as splenomegaly, also called an enlarged spleen. Splenomegaly occurs because of all the increased pressure in the surrounding vessels of the liver due to the blockage of regular blood flow as a result of the scar tissue. Now, this increased pressure causes surrounding organs such as the spleen to increase in size. Number 2 on our list is the presence of ascites. This is when excess fluids collects in spaces within your abdomen. Now, this happens because when your liver doesn't work like it should, pressure builds up in the main vein that supplies the liver. This extra pressure blocks blood flow to the liver and also affects the kidneys, meaning fluid builds up in your body. Over time, this fluid leaks out of your veins and collects in your abdomen. Now, last on our list is a condition known as spontaneous bacterial peritonitis. This is the most common bacterial infection seen in liver cirrhosis and is due to bacteria infiltrating into all of that fluid built up within the abdominal cavity. This is what we see in ascites. Now, symptoms of this include severe abdominal pain, temperature, nausea, and vomiting. You can see here that patients with this condition can be really unwell. So now we know some of the common signs of liver cirrhosis, it's important to think of ways to reduce your chances of actually reaching the stage of irreversible liver damage. Now, the main causes of this condition are excessive alcohol intake causing alcoholic liver disease, fatty liver disease, and viral hepatitis. Therefore, simply being aware of how much alcohol you are taking in and keeping this within the normal government guidance is so important. The same goes for keeping an eye on your diet and any other conditions such as diabetes in order to reduce your risk of getting fatty liver disease. So, everything I've said in today's video is so important, but like I mentioned before, avoiding conditions such as fatty liver disease, which can lead to liver cirrhosis in the first place, needs to be made a priority. That's why I created this video here on fatty liver disease. Please make sure that you check this out. As always, if you found today's video helpful, please leave a like and subscribe. And remember, I truly care about your health and I wish you the very best.